I think for me, and what's really important for people living with diabetes when you go into appointments, is that you're seen as a human by your healthcare professional and not just numbers and not just a data generating person, that you're a real human with emotions who is living with a chronic condition. And that goes such a long way, because then you connect on that human level, and that builds that trust that everyone has mentioned so far. And when I've just been seen as somebody who generates data, that's when I've not connected. When I'm seen as a human, that makes such a big difference to me, and I'm sure to everyone as well.
If you notice that you're feeling panicky, that you're feeling anxious, that what was said has made you feel really uncomfortable, name it, because I think a lot of the time as healthcare professionals, we can be guilty of not tuning in to how somebody's doing emotionally, that we can have our own agenda, we've got our own discussions, our own questions that we need to get through. So naming it is really helpful.
And we had that word quite a few times, the positive interaction. I think positive interaction is very important. And you need to show that you understand the difficulties that a person with diabetes is going through. And this is how you develop that relationship, and this is how you can help that person. Because, I mean, quite frankly, diabetes is a highly complex condition. And sometimes we try to oversimplify it when, again, we heard quite a few times that this is a full-time job, and it is a full-time job most of the time. So I think this positive relationship is very important, and this is why continuity of care is very important. And quite often, the main concern comes out at the end of the consultation. We talk about a lot of things, and then at the end, numerous times I say, "There's something that you haven't told me. What is it?" And then the patient comes out with it. So I think having that relationship with the doctor, and not only the doctor, of course, the whole team, because, to look after a person with diabetes, you need the nurse, you need the doctor, you need a psychologist. In our clinic, we do have a psychologist, the dietitian. So it's a teamwork, and they need to have those questions for the team prepared and not be afraid of asking those questions, because it is their health at the end of the day. And I always tell my patients, I'm actually working for you. You're the boss. I'm just working for you.